Hi everyone. In this video, I will talk about what you need to know before choosing to become a registered nurse in 2021. Before I begin, I want to say that this is one person's opinion and that each person's opinions may vary depending on where they are working as a nurse. Again, this is my opinion as a bedside nurse that has been working over a little over a year. In this channel, I talk about all aspects of nursing. If you're interested in learning more about what it is like being a registered nurse, consider subscribing. I also would appreciate it if you would give the video a thumbs up if it has brought you any value. Lastly, be sure to check out the description box where I have links to free ebooks I have created and some interesting products for nurses or nursing students. With that being said, let's get on with today's video. Nursing is incredibly challenging, and I have mentioned this in previous videos. However, these are the most important facts that you must understand before choosing this profession. The first is being overworked. Patient presentations vary. Some patients may be extremely sick and others may not be as sick. This variance creates an extremely challenging situation where workloads can be difficult to keep up with. For instance, a person requiring monitoring every 15 minutes is going to make it significantly more challenging to provide care for the other 3 patients you may have. This means that you will put more focus on one person than others. But what if you have 2 patients that require frequent monitoring? What if one patient requires frequent monitoring and the other one crashes? This is just a simple example of how a shift can be extremely difficult to manage. Now, managers and hospital administration are actively trying to figure out ways to adequately assess whether the workload is appropriate for a nurse. But when you have sick people that have varying needs, it can be very difficult to have a standardized tool to decide if the workload is appropriate for a nurse. Therefore, there are going to be days where you are going to have insanely busy days and other days where you're going to be able to effectively provide care for your patients. Now, I'm saying this because it is the reality of nursing that is not really spoken about in school, and to be honest, you don't really experience it as a student because you're always working with an RN who is watching over or taking half the assignment. Consequently, you're not really expecting this until you have worked a few weeks on your own and realize that the workload can be way too much for a nurse to handle. To be fair, the managers and the administrators try their best to manage the workload, and you definitely get a sense that they are trying to make the work situation and environment better. However, the reality is there are some gaps, and I don't really see how they can adequately staff the floor to meet the needs of the patients because it varies so much. Another incredibly important aspect of nursing that no one really talks about is the magnitude of information out there that you will never truly know. Let me explain. Nursing is about providing care for patients in all walks of life. However, there's so many complex diseases, conditions, and patients with different combination of these diseases that make it extremely challenging to know everything about every condition. That is why the NCLEX focuses on your critical thinking, because it knows you can't possibly know everything, but your ability to problem solve and critically think about what is best for the patient is what is going to make you an excellent nurse. I feel that this was not really talked about in nursing school. They taught you diseases as if one person had one health issue and that is it. However, when you go to the hospital, you will quickly realize that people that are in the hospital are the ones that not only have two of these illnesses, but even 4 or 5. I hope this video was helpful or you enjoyed it. Let me know what your thoughts are on this in the comment section down below. Do you find this to be true? Again, this is my perspective, and I'm sure there are varying opinions on this. Thank you for watching this video, and I will see you in the next video.